Good morning, ladies and gentlemen. You're all very welcome to this morning's HSE webinar on mental health in these challenging times. Before I hand you over to your host this morning, just a little bit of housekeeping. You're all in Zoom webinar format. So there is a Q&A button at the bottom of your screen that I would encourage you to use right throughout the event. We have a great panel here today, busily answering questions in the background. So please feel free at any stage to type in questions. We will also have a panel discussion towards the end where we will have time to address these questions in the panel discussion format. So without further ado, I'm going to hand you over to your host for today, Fergal Fox.
Hello, everybody, and welcome to our webinar today on International Men's Day, and happy International Men's Day to you. Just looking at the agenda here that we have on offer today, we have Minister Frank Feehan giving us a welcome address in a few minutes, and we'll have Dr. David Meredith up as our presentation on farmers' well-being, followed by Ashley McGrath, who will present to us some very interesting research in relation to men's sheds. We have Ian Power then, who's coming from the spunout.ie, who has a presentation on youth, young men, and their insights on that in terms of COVID and mental well-being. Biddy O'Neill will chair a panel, and as Leo just said there, we have a very exciting panel. We have Colin Regan from the GAA, we've Martin Rogan from Mental Health Ireland, and we've Noel Richardson from IT Carlow, and Ian Power again from Spunout, and Colin Fowler from the Men's Health Forum in Ireland. Just by way of introduction to myself, my name is Fergal Fox. I work as the head of stakeholder engagement and communications in HSE Health and Wellbeing. But my first job in the health board was working with traveller men and male adolescents in relation to health promotion. So I have a keen interest in men's health, and part of my current role in HSE Health and Wellbeing is chairing the advisory group on our Healthy Ireland Men Action Plan. So we develop a plan every year to deliver on that, and some of our core programs have been really challenging this year in terms of our engaged training delivery, because we're not doing face-to-face delivery. But a lot of our agencies are working like this, trying to do webinars and reaching out, and are one of the key agencies in the delivery of the engaged training program, the Men's Development Network, is working to develop our online training supports, and hopefully we'll be even more effective at continuing that work in 2021. In terms of, I suppose, the theme today, we saw the opportunity of International Men's Day and thought we had to address some of the issues for mental health. And we were lucky to have lots of research going on this year, and some research that had started before COVID hit, which gives us more interesting insights, I think, in relation to the impact of COVID and where we're at. So I hope you enjoyed the day. I really appreciate you taking the time to tune in to us today. And I can see from the audience registrations that it's a very diverse audience we have on here today, from the health and social care sector, from public, private, an increase in interest from workplaces, and loads of individuals from the community and voluntary sector, or people just tuning in for their own health and wellbeing needs. So whatever it is, we're delighted that you tuned in today and hope that you get something out of the day. I would invite you to kind of reflect as you listen to the presentations about the men that has kind of brought you here. If it's your own interest as a man listening in to learn something about health and wellbeing, or if it's somebody in your family or somebody in your community, just think about those men today. And I suppose International Men's Day is an opportunity to celebrate men, and we want to take that opportunity today while also highlighting some issues that we think that we need to continue to work on and address in relation to men's mental health. So the first item on the agenda is we have a video from Minister Frank Feehan, who will give us a welcome address. So if we can roll that video, please.
Good morning, ladies and gentlemen. I hope you're all keeping well. I would like to thank the HSE for inviting me to address you all today on International Men's Day. In my role as Minister for Public Health and Wellbeing and the National Drug Strategy, I would like to welcome you to this seminar. I would also like to thank all of you for your interest in and support for men's health. I am proud that Ireland was the first country in the world to adopt a national men's health policy, and that we remain a world leader in this field. Indeed, through the work of Healthy Ireland and the delivery of the HSE, Healthy Ireland Men Action Plan, we have a strong network of partnerships and key stakeholders who drive and deliver initiatives on men's health every year with the HSE. However, this year has been different in so many ways. COVID-19 restrictions have posed immense challenges to our mental health and well-being. The purpose of this webinar is to highlight some key learnings about how men, in particular, can be supported to adapt and cope with the challenges in our environment today. On International Men's Day, it is important to acknowledge the role that men and boys have played in the response to COVID-19. Recently, we launched the new Keep Well campaign, which encourages everyone to stay connected. Due to the stress and strain that comes with COVID-19, there is a need to stay connected, especially with the most vulnerable men. I would like to encourage everyone to look out for and check in with the men in their lives and communities. I know that many of those involved today have done so much to keep people connected. For example, the GAA, Spun Out, Irish Men's Sheds, and Mental Health Ireland, to name but a few. I understand that most of you attending today support men's health either through your work, volunteering, or in your family, and I'd like to take the opportunity to acknowledge your contribution and efforts. I hope that you will all benefit from the presentations and discussions forum today. And Minister Responsibility, I want to thank you for taking the time to support men's health on International Men's Day. And I wish you a very successful webinar. Thank you.
And thank you, Minister, for those kind words. So I suppose, as the Minister just said there, the theme of keeping connected is one that we're trying to promote under the Keep Well national campaign around resilience as part of the Resilience and Recovery Plan for Ireland. And I think this sits very well with what's the theme of men's mental health that we're talking about today. So I think it all fits very well together. Before I introduce our presentation on farmer wellbeing, I suppose I just want to give a shout out to the Men's Development Network, who are doing a campaign today, Rating Men. They're inviting people to, I suppose, identify some man in their life or just by their first name on social media and say, what are the positive qualities? Earl, if you can share that slide for me there on the Men's Development Network. There it is, yeah, with the hashtag Celebrate Men. So I just encourage you to engage with this today or to check it out on social media. As I mentioned earlier, the Men's Development Network do a lot of work with the HSE and around the country in relation to the Engage Men's Health Training Programme, which we have support on from a variety of agencies, some of which you'll hear from today. But the Celebrate Men idea, I suppose, is just trying to highlight as many positive examples of positive masculinity as we can on today, as it been International Men's Day. So thanks, Earl. I suppose going on now to the farmer wellbeing, and I asked you all to kind of reflect on the men in your lives. And when I think of the farmer wellbeing, I'm thinking about my own father, who's recently retired from farming, but is still probably working 6 or 7 hours a day on farming, but that's a lower pace than I was raised to watch him working on him. Also my brother who's working as a farmer at home. So I'm very interested in the research in relation to farmer wellbeing, and we had some excellent reports launched this year in relation to farmers wellbeing. Most recently, we launched the On Farm Ground research report, which you may hear a bit more about later on, and earlier in the summer, the Farmers of Hearts research report, which I hope David will refer to. So I'll hand you over to David now, and the best of luck, David Meredith. Thank you.
Thank you very much for that, Fergal. So yes, my name is David Meredith, and I work for Teagasc in their Rural Economy Development Programme. And I'm going to kind of provide an overview of some research that is ongoing at this point in time, and then reflecting on that research and what it might tell us about COVID-19 and some of the issues around that. In terms of a bit of background, for those of you who don't know, Teagasc is the Irish Agriculture and Food Development Authority. and it's divided between a number of directorates, and I work in the research directorate, but I collaborate very closely with colleagues in the knowledge transfer directorate and the education and training directorate. And key colleagues in knowledge transfer include include Francis Bly and John McNamara. The research is funded through a variety of funding agencies, not least Teagasc, but also the Department of Agriculture, Food and Marine, the Health and Safety Authority, the HSE, and then a number of private organisations, including Glanbia and the Irish Heart Foundation. So we undertake this research in partnership with a variety of third level institutions in Ireland. So we have IT Carlow, Waterford Institute of Technology, UCC, Maynooth, UCD, and NUI Galway involved in the research. And the program is divided between safety, health, and well-being. And I'm going to very much focus on the health and well-being side of things today, and present very small summaries or short summaries of the work that has been undertaken by Diana Van Doren, who Fergal has just mentioned there, Mary Brennan, who's in Cork University or UCC, Conor Hammersley, who's at IT Carlow, and also Alexis O'Reilly at Maynooth University. So starting with Alexis's work, he's been supervised by myself and Dr. Ronan Foley in the geography department in Maynooth. And his work focuses in on the issue of social isolation and is concerned with trying to assess isolation amongst farmers and to draw out what the implications of that are. So social isolation refers to people who may have limited contact with social networks or community. So it could be family, community, sporting organizations, churches, and so on. And so social isolation is important because it's been linked to issues of poor quality of life and poor mental health outcomes. Now, farming is an unusual occupation in many senses because most farmers tend to work alone for long periods of the day. So the nature of the work is isolating in and of itself. And over time, we've seen greater levels of lone working. So in the past, where a number of people might have worked together, increasingly it's a case of working with machinery to do a job by oneself. So we're interested in trying to understand this issue of isolation amongst farming. We undertook an analysis of a very large data set called Tilda that traces or tracks people over time. And there's about 500 farmers in that data set. And rather than compare farmers to the rest of the population, we compared farmers to people like farmers. Okay, so it's a direct comparator group. And we did find that farmers are less likely to have intimate social relationships by comparison to the comparator group. But we also found that farmers were more likely to have helped a neighbour and received help from a neighbour. And we find that farmers are just as likely to participate in a social activity or social group than non-farmers. So in many respects, farmers are no more engaged than others in society, and they are less likely to have intimate social relations. So these are visits from family, to or from family or friends. And it speaks to an issue that is covered in a video that will follow this from a farmer, Brian Daniels, who talks about the small things that farmers can do to maintain contact with other farmers. And in relation to COVID-19, what we see is that the impact of the restrictions may have increased the risk of isolation among some farmers. But there's also that aspect that people became much more aware of the need to make contact with and stay in contact with people who are at risk of isolation. So in some respects, there may have been a positive benefit there, but that doesn't take away from the fact that many farmers are at risk of isolation. Looking then at issues of well-being and stress, and this is work that was referenced earlier on. So this is the Farmers Have Hearts program, and its work been undertaken by Diana Van Doren and supervised by Dr. Noel Richardson, myself, Dr. John McNamara, and Professor Catherine Blake at UCC. And the data here were collected from about 846 farmers, and they were asked about their experiences of their well-being and also their experiences of stress. And because we have such a large sample of farmers, we're able to look at maybe differences between different enterprise groups and different age groups. So this goes back to the point that I was making earlier on about farming is changing, and with it there are changes with respect to isolation and potentially well-being and stress. And one of the standout results was that 36% of all farmers had a score of below average or poor well-being. So that's, over a third of all farmers are in that category. And it's not a great place to be starting from. Of those who are between 45 and 64 years of age, they're more likely to experience stress than their younger or older counterparts. And in fact, older farmers, those over 65 years of age, appear less likely to experience stress often or very often. And perhaps one of the reasons for that we've already heard today is that as farmers get older and perhaps, and I'm going to say inverted commas, retire, but still work 6 hours a day, the pace and intensity of work decreases. So the key points here are that the well-being of many farmers was poor and stress relatively high for some prior to COVID-19. But we find that there is no direct relationship between the type of enterprise, well-being, and the experience of stress. So what I mean by that, if you compare the well-being and stress levels, so 35% of dairy farmers reported relatively poor well-being or below average well-being, and about 16% recorded experiencing stress often or very often. And you contrast that to mainly sheep farming enterprises, where you've got 40% have relatively poor well-being, but the stress level is substantially lower. So that's what I mean about the absence of that direct relationship. So there are other things going on. And this is where the work of Mary Brennan, who's been supervised by Dr. Emma Dillon and Professor Thea Hennessy in Cork University Business School, have looked at different sources of stress. And they've broken this down by age group, and there's a lot more detail behind this particular piece of work as well. But the primary stressors are the ones that you'll see there in terms of poor weather, workload, and financial issues. They're the big ones for farmers, and these data were collected in 2018. So with respect to those stressors, they're the main ones, but there's a whole host of other ones as well in terms of animal welfare, compliance with schemes, so that governance and policy piece, farmers' sense of security, their access to labor, their assessment of their own isolation, and issues around succession. And the isolation one is quite interesting because farmers don't necessarily report it as being an issue for them. But the question we have is whether or not it actually is an issue and it's just been managed, or farmers are coping with it in ways that may not be necessarily all that healthy. And that speaks back to some of the results from Diana Van Doren's work, where she found over 75% of farmers had multiple risks of cardiovascular disease as a consequence of poor or unhealthy lifestyle. So that relates to diet and exercise, and also that social contact piece. The other key point emerging from Mary Brennan's work is that stress isn't one thing, it's a combination of stressors. And the main one here, weather, so far in 2020 has been relatively benign. So this year we'd expect to see lower levels of stress associated with that, but the other stressors remain the same. And with respect to COVID-19, the interaction of COVID-19 with these other stressors may have had both positive and negative implications. So in the instance of access to labor, perhaps people returning to the farm to basically work from home meant that there was additional labor there to help out with tricky tasks or dangerous tasks and that sort of thing. But equally, having more people in the household than people would be used to may have contributed to stress. So it's very much dependent on the characteristics of the individual households, what the outcome was there. And then finally, we get to the work of Conor Hammersley. And Conor's been supervised by Dr. Noel Richardson, myself, Dr. John McNamara, and Dr. Paula Carroll from Waterford Institute of Technology. And his work takes a much longer term perspective. So it isn't about necessarily the day-to-day stressors, but it's looking at how agriculture is changing over time and the implications of that for farmers' farming practices, and then how that impacts on a farmer's sense of identity and consequently their well-being. And that research is feeding into the development of a program of supports for farm advisors with a view to then supporting the well-being of farmers. And in doing so, it seeks to address well-being challenges arising between kind of the multiple demands that farmers are faced with today in terms of producing food for us, but also ensuring that that food is produced in ways that supports the environment, maintains biodiversity, maintains water quality, and so on. So it's a much more complex ask that society is placing on farmers, and all at the same time that farm prices, aren't necessarily increasing to reflect the increasing demands upon them. So to recap then, what we see is COVID-19 and related restrictions may increase the risk of isolation among some farmers. Isolation isn't seen by farmers as being a key source of stress, but it does not mean that it is not an issue. Okay, so the question really becomes one of, are farmers' coping mechanisms for isolation healthy or unhealthy? And we'll hear in a second from a farmer, Brian Daniels, about how he copes with that. The well-being of many farmers was poor and stress rates were relatively high for some prior to COVID-19. Now, the implications of COVID-19 may have interacted in different ways for different types of farm households. So it could have reduced issues of isolation and some of the stressors because people have returned home, but equally for other households, it might have actually magnified the problem. All farmers, regardless of enterprise type, who have stressors. So there isn't a particular group out there that are sailing along and it's all fine. All farmers have stressors and they vary by age. So we see farmers that are less than 45 years of age. The key issues are workload and labor. For those who are between 45 and 54, it's workload and finance. And as farmers get older, the stressors reduce. So the issues around weather, workload, and finance aren't there to the same extent. And this is the point about stressors being, for most, a combination of stressors. So it's rarely just one thing. It's a combination of things that come together. And frequently it's that stereotypical straw that broke the camel's back. And COVID-19 will have interacted with these stressors in both positive and negative ways, depending on the characteristics and resources of the household. And we'll hear a bit about this now in a video presentation from Brian Daniels, who's a dairy farmer, and talks about how COVID-19 impacted on him throughout this whole year. So at that, I'll finish up. Thank you very much.
Yeah, when all this thing originally started back in late February, early March, we were quite busy on the farm. We were in the middle of calving. We had 310 cows to calve this year, so things were quite stressful and busy at that time. The original fear of it was worse than actually how it turned out. Myself and my wife, we spent a few evenings chatting on the couch as the kids went to bed and kind of put plans in place. If the staff members had to leave the farm, how would we cope? How would we get the work done? Those couple of chats were very good at the start. it allowed us to think, and really lockdown didn't have too much effect. The kids were at home. It was a nice, friendly environment. The work got on. Our staff members stayed with us through it because they felt safe enough on farm. So it's been fairly good. The initial shock of it all was the worst part. Out around in the community, there's been a different feel, how different farmers have been reacting. A lot of the farmers I know would be in discussion groups, and we've had online meetings, Zoom meetings, conference calls. The more remote and isolated farmers, they have been feeling it worse. We have made a point of meeting on the road and chatting from Jeep into a tractor cab, or as we meet around, just making sure everyone's getting on all right. But there has been some people that have felt quite remote and isolated from it. But generally most farmers are fairly aware of it and are trying to stay in contact with people. So when the original lockdown started in, I remember having conversation with two of my closest neighbours, and we were very much aware of how other people were going to cope, and I remember speaking to two of them and saying that, look, we'll make a point of making sure everyone's all right. I remember talking to one of my neighbours who was quite concerned of the approaching breeding season for his cows and how he'd manage. And like we offered hand that we would make sure that he wouldn't be isolated from it, that we'd get him through the period if he needed. We'd adjust and find either bulls or provide services ourselves to help him get his cows into calf. The different people and different personalities, different things work. I know for myself, I like having a bit of time to myself. I like handcrafts. I enjoy working with steel and carpentry particularly. I enjoy doing traditional field crafts such as hedge laying and things like that. I find turning off from the world sometimes, giving myself an hour or two off to do the most minuscule, pointless work that some people might think, but it helps me clear my head. Also, find the things that are positive. Like lockdown was brilliant having the kids around. I know it was stressful in the point that they were always there, but there was great little gems of having them out on the farm, tipping around with us, doing the smallest, minuscule little jobs. That was one thing that we really enjoyed from the lockdowns. So we look for the positives in it, the things that make us happy, the things that really kind of give the whole focus of why we're doing the work we are doing. And I know we have, Gail and myself, discussed during the real bad times, 18, during the spring of 18, when we had the real bad snow. We got snowed in here for almost 5 days. We had to dump milk. I remember saying to each other, and we said it during the lockdown as well, we only have to get to tomorrow. And then when we get to tomorrow, we say it again, we only have to get to tomorrow. And it breaks down the whole thing into small, more manageable little pieces. The main thing is, don't be afraid to reach out. Call in just for a chat, talk about the weather. If you're feeling down yourself, ring a friend or talk to a member of the family. It's just turning off from what might be affecting you. It'll distract you. It'll make your mind wander into something that's a bit more pleasant, hopefully. But either reach out to somebody that needs help or reach out yourself. That'd be it.
Thank you very much, David, for your presentation, and thanks to Brian for that video. That was really inspiring. He just broke it down so simply in terms of practical things that people can do in the farming context, but in terms of the messages he was given there about staying connected and staying positive, it really applied to us all. I'm reminded of our recent series of videos that we launched, Minding Your Wellbeing, around positive mental health. And Brian put the message really simply for farmers there about trying to look at positive things, trying to look for activities that you can immerse yourselves in. And listening to Brian there, like he really, I suppose, gets so much out of his work farming, but he realizes that there's all other supports needed for your health and well-being, and he's a great lookout in his community as well. And it's those community connections that we've kind of depended on, I think, this year in terms of COVID, for men and women. But so that was really positive. Thanks to you both for that input. Just before I move on to the next presentation, I should say that the Mind in Your Wellbeing videos are available on yourmentalhealth.ie, and they're also available on our YouTube channel at HSE Health and Wellbeing for anybody that wants to get a look at them. And I would encourage you to share them with men that we can see that we've had a very positive uptake of viewers on the videos, but predominantly our viewers are women. And I can see one of the comments came in there about the lack of, I suppose, all the content on social media and the limitations sometimes that presents for men. So that is an issue, I suppose, that we're struggling to deal with in terms of all our work with men's health. But we can see that a lot of our activity online is working with the people that are working at community level and trying to help the helpers, if you like. And we see, I suppose, the audience, particularly today, is engaged not usually for themselves. They're trying to support and work with other men. So we appreciate that. So the next presentation we have is from Aisling McGrath. And Aisling has been working on the Sheds for Life piece with the Irish Men's Sheds Association for a couple of, for a good while before COVID started. So we've been funding the Irish Men's Sheds to develop a health and wellbeing program for a while now. And Aisling came on board and was researching the initiative, and then COVID hit. So it gives us a unique insight into the impact of COVID. And we're delighted to see that the Sheds for Life, while it's been hit this year in terms of its ability to roll out the program with all the partner agencies, and Aisling will tell you a bit more about the partners, but they've also received funding support from Sláinte Care. So we'd be hopeful in the coming year to make real advances with the Sheds for Life program. So I'll hand you over to Aisling to tell you a bit more about her research.
Thanks very much, Virgo. Let's get this up. Okay, so I'm delighted to be with you all here on International Men's Day. And as Virgo said, my role is involved in the evaluation of a men's health and wellbeing program that's delivered in the men's shed setting, which is called Sheds for Life. And through the research, we gained some insights into the impact COVID was having on the wellbeing of our men's shed members. So this research is supported by the Irish Research Council, and I also just want to thank my supervisors, Dr. Niamh Murphy and Dr. Noah Richardson, as one of our panelists today, for the support with the research. So just briefly, Sheds for Life is a 10-week men's health and wellbeing program. It's delivered in the men's shed setting, and it uses a collaborative approach to work with the men's shed members to respond to their needs and build upon the inherent health promoting qualities of the shed, and at all times respecting the shed environment, in order to promote its systematic uptake and avoid those translation issues that can sometimes occur when rolling out programs. We use an implementation science approach to evaluate the program. It's a hybrid approach where we look at the effectiveness outcomes, but also the effect of the implementation. And so to do that, we engage a host of key stakeholders. We've got the shed members themselves, but we also have our partner organisations, which Virgo mentioned, and you can see here, that make Sheds for Life possible and deliver the different components of the programme. We also work with the Men's Sheds Association and then look at the wider systems level, so our funders and the types of policies that influence men's health programmes. So the Sheds for Life programme responds to the need for gender sensitive strategies that work for men and make it easier for men to engage with health and target gender inequalities that exist in health. So the foundation upon which Sheds for Life is built upon is really the shed environment, the social support, the non-clinical environment that's found there, and that safe and familiar environment. And we use tailored and targeted intervention to respond to the needs of the men's sheds members, and sometimes what may be a hard to reach group of men. So as part of the Sheds for a Life evaluation, we were following 2 groups of men over time, up to 12 months, and it was quite quickly apparent that COVID was going to impact their health outcomes. We know more broadly that men and women are differentially impacted by COVID. We also know that more men are dying from COVID, and that can be in response to a range of different factors, such as potential lower immune responses, gendered behaviours and practices maybe relating to masculinity, maybe disinclination to adhere to public health guidelines, or delayed help seeking, pre-existing comorbidities like cardiovascular disease or diabetes. And all of these contribute to that excess burden of comorbidities and mortality that's preventable and avoidable in relation to men, and what Sheds for Life aims to directly respond to. But also what COVID is now really shining a light on, that gender inequality that exists and that need for that to be addressed at policy level. So we researched the impact of COVID on the wellbeing of the Irishman Sheds members, and that's been peer reviewed, and it's in Health Promotion International shortly as well. So what we did was we followed 2 groups of men on a phased basis, delivering the Sheds for Life intervention in March and September 2019. We administered questionnaires at baseline, 3, 6 and 12 months, assessing their wellbeing outcomes, so looking at things like life satisfaction, mental health. And we compared the findings at 6 months from one group during COVID with the findings from another group at their 6-month point, which was prior to COVID. We also adjusted the questionnaires at 6 and 12 months for the group that were experiencing COVID, just to measure that direct COVID impact. What we learned was that both groups experienced an increase in self-rated health after the Sheds for Life intervention, so how they rated their health from excellent to poor, but there was a significant reduction in self-rated health afterwards for those experiencing COVID, something that didn't happen in the group that were not experiencing COVID. In relation to life satisfaction as well, during COVID restrictions compared to levels reported prior, there was a significant decline, and previously both groups had experienced a positive increase, which was sustained in the group that were not experiencing COVID. And similarly, there was a reduction in the extent that men Shed members felt the things that they were doing in life were worthwhile during COVID compared to before COVID as well. We also measured mental well-being, and you can see at baseline there was a significant increase at up to 3 months. That remained sustained in the group that were not experiencing COVID. So there was a significant difference from baseline at all other time points in the group that weren't experiencing COVID. But the group that were experiencing COVID did see a decline in their mental well-being scores at 6 months, which is during COVID, and 12 months, with a significant difference from the 3 to the 12-month point. However, it did remain higher than baseline, which is positive. In terms of their physical activity, men living in rural areas reported a higher rate of physical activity during social restrictions compared to urban areas. There was also a decrease in days active from the 3 to 6 month point in the group that were experiencing COVID, not in the group that were not experiencing COVID, and previously both groups had experienced a significant increase in their days active. The group those meeting the physical activity guidelines had significantly lower loneliness scores compared to those not meeting the physical activity guidelines as well. And those in the group that were experiencing COVID who were meeting the physical activity guidelines prior to COVID were more likely to increase or maintain their activity during COVID, with those not meeting the guidelines more likely to decrease their activity. So one of the biggest issues, I suppose, that we faced in terms of COVID and the Sheds was loneliness. So we had an idea, I suppose, when we first started the Sheds for Life evaluation, that the Sheds were already quite protective against isolation because of the social support that they offered. So we asked them in to rate their levels of loneliness prior to joining their Shed, and then again at baseline 3, 6, and 12 months. So you can see here at the pre-Shed level, so before they joined the Shed, their loneliness was significantly higher, and it did reduce for both cohorts at T1, which is baseline. It remains statistically similar up until the T3 point, which is the 6 month point during COVID restrictions, where cohort 2, which are the orange line, had a significant increase in their loneliness scores, which unfortunately continued to rise up to T4, which is the 12 month point. Anyone who had a score of 6 or higher on the UCLA loneliness scale were categorized as lonely. So unfortunately, Shed members who fell into the lonely category rose from 1.4% prior to Shed closures to 29.7% at 6 months, and then 39.2% at 12 months. And those in the lonely category had significant health ratings, days active, and life satisfaction scores, with those living alone significantly higher loneliness scores during COVID, which was not something that we found prior to COVID. So I suppose what the research shows is that it highlights some valuable longitudinal data on the impact of COVID on the well-being in an sometimes understudied and hard to reach group of men, highlights the potential deleterious impact COVID can have on a group of men who are probably arguably already somewhat engaged with health just by being members of their Shed and also participating in Sheds for Life. And the restrictions alongside the loss of the Shed as a social and emotional outlet for Shedders has had a significant impact on the well-being of some Shed members, evident by the sharp rise in loneliness and decline in well-being. What I will say though, and I think it's important to address, is that loneliness is subjective. Not all men Shed men's shed members are lonely. Some are coping very well and have adapted quite well. So I never want to label or stigmatize anyone or reinforce that, idea that older men can be chronically lonely, but COVID has had an impact on us all, and none of us are immune. So we do need to be mindful of the impact isolation can have on our mental health and look out for the men who are a little bit more vulnerable. And it's not all negative. So, something special does happen in the men's sheds. They're amazing spaces, and so are the men you meet within them. So I've been privileged to work with a number of sheds across Ireland, and I hope to be able to do that again really soon. What I can say is there's a resilience there, and there's a sense of community that is special, and the social support and bonds that have been cemented in the sheds, I believe, will transcend COVID and transcend the shed. And there's evidence out there that the men are doing great work and staying connected and looking out for one another. And they will come back to the sheds and continue to support each other. And those who are a little bit more anxious, I hope, will find their way as well. And what this study brings home is how important the sheds are for protecting against loneliness. And they're a testament to the strength of the men within them. So I would say to any men's shed members watching, keep the faith, and the sheds aren't going anywhere. So I know you're going to find your feet again. And if the Sheds for Life programme comes to you, please give it a go. The sheds also provide opportunities to engage with health and wellbeing in a way that suits the needs of men. And the broader Sheds for Life research is demonstrating the positive and sustained impact this has had on men who have participated despite COVID, like their baseline mental health and wellbeing scores remaining significantly higher. So Sheds for Life and the sheds will be needed more than ever in the wake of COVID. And just going forward in relation to the Sheds for Life research, we hope to be able to adapt Sheds for Life to be implemented under COVID safely, using that collaborative approach and engaging our key stakeholders. And we hope to just overcome any barriers that we may face in doing that. And also just always remembering to respond to the needs of the men who are at the heart of this. So possibly inclusion to a digital literacy, which has come up, that digital divide. And also sometimes they are a hard to reach group. And so they may not be as forthcoming as one shedder summed up quite well there, that Sheds for Life worked because he came to us. We wouldn't be as forthcoming as to go to it, that's men for you. So it's just about finding a way to engage them and keep them, and bring them back to the shed safely. So that's what our goal going forward. So thank you very much. Next, I just want to introduce an absolute gentleman, Tony Collins, who recorded a video for us. He's in the Leak Slipman Shed. So Tony, if you're watching, I hope you're well. And he just gave us some insights into what Sheds for Life was like for his shed, and also just insights into the shed, into what Sheds for Life was like for his shed, and also for the impact COVID may have had on the shed as well.
I suppose the committee's decision to participate in the Sheds for Life was vindicated by the number of members that actually participated. We had large attendances, upwards 20 and 20 plus members at some of the various components. We were a new shed, we had new members coming in. It was an opportunity for them to bond and to get to know each other. But looking at the different aspects of Sheds for Life and the program that was there were some aspects of it on mental health, on suicide awareness, which were very, very well covered by the HSE. I was quite surprised that some of the members who were participating actually opened up very, very easily during some of those sessions. Some of them that may have had issues or may have known people or family members who had some issues. So it was very beneficial for people to talk. But it was the bonding of the men themselves, the opportunity to bond in those sessions that really kicked our shed into life, really, in terms of being a new shed. We've lost that momentum now, that people are not used to coming to the shed. The shed is closed. That's the advice that we have got. So unfortunately, we're going to have to try and make some effort to get back what we had with that program. Now, during the summer of this summer, we did organize some essential maintenance for our shed and the immediate area around the shed, some essential maintenance that needed to be done. And we got volunteers of up to 10 people to come. Now, all of that was done with observing the various protocols, during restrictions and maintaining distance, but we were all outside, so it was an outside activity. So that was the one opportunity, I suppose, that we've had during all these COVID restrictions to get some of our members together. From a communications point of view, what we've done is we have a WhatsApp group set up And I've a total of 27 members in that WhatsApp group. So if there's any messages that need to be issued or any communications with members, we use that WhatsApp group. So the guys are actually communicating with one another. If somebody has a bit of news about anything at all that may be of interest, whether it be shed business or otherwise, they would communicate through the WhatsApp group. So from that point of view, we have something going. I would be aware of some of the members' own personal situations. I would know some of them, and I would know that they're not isolated. They're not, in a situation where they have no support. I wouldn't be aware of all of the situations there. So that is one of the disadvantages of not being together and not having an opportunity to get people together, to find out if there are any problems, if people have problems. Now, we have issued, say, communications telling people if they have problems to get in contact. But some people, can be men, as can be slow. And certainly face-to-face, you have a far better opportunity to ascertain what people's situations are, but through text messages and WhatsApp groups, it's not the best. It's not the way. It's not the best way forward.
Okay, thank you very much, Aisling. Thank you very much, Aisling, and thank you very much, that shedder there from Leakslip, I think you said it was. So it's really inspiring again to hear those insights. And I suppose what we can see identified there is the precious and sacred space that has been created by men's sheds, and people and men especially want to protect those and want to get back to those as soon as possible. So it's really, I suppose, an obvious hit where you attend a shed for social support and then you experience COVID. So we absolutely hope that we'll be able to regenerate the Sheds for Life program, and that Aislin's work can continue in that context for men across the country in the variety of sheds that are taking place at community level and trying to come back together as soon as possible. So moving on to the next presenter, we have Ian Power from Spun Out, and Ian has a very interesting presentation in terms of young men's mental well-being, and he's going to share some insights on the 508 service as well. Take it away, Ian.
Great stuff. Thanks so much, Fergal, and thanks for the invitation to take part this morning. As Fergal said, I'm just going to talk you through some of the findings from a recent consultation that we did with young men in particular. But just first, I guess, spunout.ie, it's Ireland's youth information website. So it's for all young people, it's by young people, for young people. So we've a youth participation structure, and we're driven by data insights in terms of what young people are looking for, and we respond to produce information resources and to share a platform for young people to talk about what's going on for them. So some interesting insights there today on International Men's Day around kind of gender expectations around and how that affects men's mental health in particular, so and particularly young men. So I'd encourage people to go on. We have a monthly readership of around 180,000 young people, and it's predominantly from a gender split perspective. It's about 60% female, 40% male. So again, I think it kind of hits home the point that we need to do more to kind of encourage young men to reach out and seek information and support in their lives. So the piece I'm here really to talk about today is How's Your Head? It was a consultation around understanding young people's experiences of COVID-19. It was done in conjunction with the Department of Children and Youth Affairs in order to inform the resilience and recovery roadmap, essentially. So to inform policy making and what young people felt was important to them going forward. Just over 2,000 young people, nearly 2,200 young people took part in the consultation in full. Nearly 3,400 answered in some way, shape or form. And what we did here was we asked young people 4 open-ended questions. So we had done some kind of surveys up until that point when we conducted this consultation in the middle of the summer in July. But we didn't want to presuppose any issues that might be coming up for young people. So we asked them 4 open-ended questions. what they were finding challenging, what they're finding difficult and hard, you know, kind of what they were finding positive, maybe what they'd like to keep going forward, and you know, what their feelings were about the future, and then what would help them to be healthy and happy at the end. So today I'm going to talk you through some of the findings just as they relate to younger men, and maybe contrast those with the findings overall. So in terms of the age spread, it was pretty representative in terms of CSO classifiers. And one of the things we were really interested in as well was not just kind of what county young people lived in, but what their context was. So we wanted to make sure we got a good spread of young people who lived in urban areas, mainly urban areas or mainly rural areas. We asked them to classify those. In terms of gender identity as well, we had a good split between men and women, young men and women. So a pretty close kind of to balance there. So in terms of young men, the challenges, the most common negative effects related to mental health, which is not necessarily in itself surprising. Young men in rural areas were twice as likely as those in urban areas to feel isolated. And I think that speaks to some of the presentations we've heard already this morning from what David and Aisling have shared. And just under a third of young men really kind of, you know, brought to the fore that they miss their friends. And they were more likely to report that loss of social life as a challenge than younger women. And they were also more likely to report that reduced sporting and exercising options were a challenge for them. They were also less likely to report health issues as a challenge in comparison to young women. They were also less likely to report school and college problems and cabin fever and isolation, and also they were less likely to report missing family. And actually, they were slightly more likely to talk about kind of being connected to family in the positives, actually, which I'll come to in a second. One of the really important findings overall in terms of all gender identities in this consultation was that 1 in 10 young people couldn't name any positive that they wanted to kind of carry forward after this experience. So just remember essentially that there are quite a substantial number of people for whom I think Stephen Fry referred to it as, you know, we may all be on the same sea, but we're varying massively in terms of the ships and the boats that we're in. So I think that that's just something that we need to kind of remember about the COVID experience. So in terms of the positives and the things that young men in particular wanted to continue, so exercise and healthy diet was the most frequently mentioned thing by young men, 1 in 4 over. Self-care, new hobbies, self-development, and they were less likely to report wanting to continue a simpler, slower or quieter life in comparison to younger women. Then just in terms of how they were feeling about the future, young men feel very optimistic about the future, actually way more optimistic than younger women. So around 43% of young men were feeling optimistic at that moment in time, 25% anxious and 17% were pessimistic. So they're more likely to report feeling optimistic, but they were also more likely to report feeling fearful and accepting of the kind of the situation. And they were less likely to feel excited about the future, which was something that was marked as well. So what would help? And so what young men said to us would help them to be happy and healthy in the future. Exercise and healthy diet was 1 in 5 mentioned that in comparison to 14% of young women. Supportive family and friends, again, close to 1 in 5 there. And work and money problems was a big issue, not having any of those. And considering that, you know, youth unemployment has really skyrocketed over the last 8 months, that's something for us to really look out for and to really make sure that the policy responses in the area of social protection and labour force activation, that they really respond to young men's needs in the next year. Young men also said they were less likely to say that education needs being met was important to them, and life balance and healthcare support. So kind of the opposite almost exactly to the challenges. So if people want to read the survey in full and the consultation in full, I would really encourage people to look at it purely because we have peppered the report itself, which is quite long, with lots of different quotes. And you can see quotes from young men littered throughout the report, including their age and kind of whether they lived in a mainly urban or rural context. And it gives a really good and rich insight into young people's experiences during those few months. And then, as Fergal said, I just wanted to briefly touch on Text About It, which is, 50808, which is our texting service. It's a listening service by text message. It was recommended in the Youth Mental Health Task Force report that this type of service be made available at a greater scale to young people in particular. We're thinking the 16 to 34 age group when we talk about young people there. And it was in pilot from September 2019, so pre-COVID, but it launched fully and publicly in the middle of June. And we've seen demand for the service kind of skyrocket since then. So we served almost 6,000 texters last month, in comparison to kind of 3,500 in June. So it gives you a sense at the scale at which it's kind of growing. The way that it works is texters get in touch with us. It's a listening service, so it's about empathetic, reflective, and active listening. They get in touch for free. It's available 24/7. We triage the queue, so we look for keywords from the texters that might indicate someone who's maybe at high risk or imminent risk. We try to get to those texters first within a minute or two, and we aim to get to all texters within 5 minutes. Sometimes that can be a little bit longer at busy and peak times. It's a volunteer provided service, so it's provided by trained volunteers who volunteer remotely from all across the country. And really what it's about is exploring and listening to what's going on for the texter for most of the conversation, and then trying to support the texter to kind of maybe discover next steps. And so sometimes that's about remembering coping skills that have worked for them in the past, remembering people who are supportive to them in their lives, but also could be about sending them resources if they're open to that. So it might be referrals or signposts to different services and, you know, different apps and other information resources that might be of help. So the volunteers are supported by a team of mental health professionals on the platform who kind of monitor the conversations and support volunteers with particularly difficult conversations. And every texter is asked if they've had any thoughts around suicide and death or dying in every conversation at an appropriate time. And really what that helps us to do is to discover kind of, you know, the real extent kind of how many texters are going through that process and thinking about suicide. And really it allows us to kind of perform a further risk assessment for those that answer, you know, that they are thinking about suicide. It's around 1 in 5 texters answer that they are. And so the ladder up risk assessment then looks for, you know, whether the person has a plan, whether they have access to means, and if they have an imminent time frame. And so really what happens in that moment, if all 4 of those things are present, the texter is supported to try to safety plan and to de-escalate their moment of crisis, and the volunteer and the supervisor work together to try to support the texter to do that. We're successful at being able to do that in about 60% of imminent risk situations, but around 40% or 4 in 10 imminent risk situations, the texters are maybe unwilling or maybe they're unable to kind of keep themselves safe. So we escalate those situations to the emergency services, and they have a protocol for how they approach the texters thereafter. So sometimes it can be engaging with them over the phone, sometimes it may be sending an ambulance unit out to a person, particularly in cases where maybe a suicide attempt is in train. And so really there's lots of different responses that the National Ambulance Service use in those moments. The main reasons for people texting into the service is because they didn't have anybody to talk to, or maybe they wanted to talk to somebody that didn't know them. So just to kind of give you some sense of what the issues are, so the majority of texters talk to us about anxiety and stress. You know, close to 40% talk to us about depression and sadness. Isolation is that they're, you know, one of the big kind of issues that people talk to us about, as well as relationships, both intimate relationships, familial relationships, and friendships, and then suicide as well. So just in terms of the gender distribution, so the majority of people, the way we know this is that we give each texter a post-conversation survey at the end of their conversation, and 1 in 4 texters complete that survey. So we've really high response rate and a huge number of responses to date. At the moment, the majority of texters are female, around 20% or thereabouts are male at any given moment in time. And one of the things that we're testing at the moment is whether or not actually it's just that younger women are more likely to complete surveys than younger men. So we're doing an in-conversation gender identity kind of disclosure for the month of December just to test that hypothesis. So just for those young men that do complete the survey, what are they talking to us about? Well, pretty much kind of the same as the overall issues that the overall kind of population are talking to us about. But I just wanted to talk briefly about some of the differences that we've noticed. So overall, in terms of younger men, they're much more likely to talk to us about substance use than any other texter profile. And also in terms of suicide, they're actually slightly less likely to mention suicide as an issue. Although you can see there in July, there's a marked difference between young men and the overall population, almost kind of 10% more conversations about suicide than the rest of the population. And then similarly then in October as well, you're looking at 19% of young men who are getting in touch with us. So basically 1 in 5 versus kind of 14.5 for the overall kind of population at that time. So the other thing we were looking at as well is just given men's help seeking, was there any differences between young men and young women in what they shared with us? So actually we found so far no. 2/3 of those identifying as men and nearly 2/3, 64% of those identifying as women mentioned an experience or shared feelings with us that they've not shared with anyone else. So there isn't a huge difference. They're slightly more likely to do so, but not in a huge number, which is quite interesting. So that was just an interesting insight, we thought. And then just finally, just there's some texter feedback just about kind of why people get in touch with us. The majority of people use the service between the hours of kind of 9 p.m. and 4 a.m. in the morning. So it's really when all other services are closed and when people feel that they're the thoughts are getting in at them late at night, particularly. And so the benefit is clear for having somebody there to listen to them in this mode. And particularly for the younger audience, there are services out there for different age groups, and there are services out there that provided this kind of service over the phone. But there's a huge number of young people, nearly kind of 3 in 4 young people say that they prefer to text rather than pick up the phone. And we think obviously that's true, and we know that to be true in terms of how young people communicate, and also the fact that they're so they're not used to picking up the phone for kind of many other reasons. So just to say, this service is available 24/7, and we really encourage everybody who's on the webinar today to kind of share it far and wide, and to really share it with the men in your life to be able to let them know that there is somebody there. And particularly, I think we find that young men benefit from the fact that this is an anonymous service, and so really, hopefully, the barriers to help seeking are somewhat less as a result. So really encourage people to get in touch with us to find out more and to visit both of our websites to find out about each of the services. And we now have a short video just from some young men just referring back to that How's Your Head consultation, and just what they were feeling in terms of this year and this period, and also as well what they're thinking about mental health and help seeking more generally.
Young people's lives have been hugely impacted in 2020. In an online survey designed by young people for young people, the Department of Children and Youth Affairs, working with spunout.ie, asked 15 to 24-year-olds to tell us about the difficulties, challenges and positives during COVID-19 and where feelings about the future now stand.
What I found most difficult about this year would have been the isolation at the beginning, the isolation and the loneliness, especially after because we were told 2 weeks and then it kept getting extended and extended and extended. So then it was just like an indefinite isolation, indefinite kind of sitting in my room on my own. So that I found quite difficult.
So what I found difficult for me during the lockdown and 2020 in particular is meeting up with people. Has been a bit harder to sort of maintain contacts and keep close friends by your side, and sort of not being able to meet them in person. I think this has been especially hard for me.
I think the thing I found most difficult about the last year or so would just be the level of uncertainty. I recently graduated college and I'm also a medically vulnerable person, so just the not knowing from week to week or month to month what things could be like was very difficult. The fact that I couldn't meet my friends in person was quite difficult as well. I really started to feel that, and after a few months the realisation that I hadn't seen some of my friends in 6 months or longer was quite difficult.
One thing I have found pretty difficult this year is school stresses. Especially being a 6th year student, I have found it difficult to not get anxious when thinking about the leaving certificate, and not getting stressed when studying or not studying.
So what I found helped me cope and get through the year. We do a lot of like video calls and group video calls with my friends back at home. Especially we do video calls to kind of keep in touch in this kind of isolation. Like they would have come up and visited me, or I would have been able to go home more often, but with various restrictions or whatever, that just wasn't possible. Other things like kind of trying to focus on my college work and assignments and keep up to date on lectures, that kind of helped me focus my mind a bit and keep my mind off fact and stuff like that.
I think having a structure to my day has been really important. I've worked from home for the last 2 months, and that really helped give me some sort of concrete to do every day and not just sort of be stuck in my bed or not knowing what day it was because I had nothing to do.
What has helped particularly is sort of the mental health support. So this has been through my own friends who will be able to sort of check in on each other. But I think especially going outside, being more in nature, going for cycles and getting exercise, I think has especially helped in keeping some sort of routine for myself.
In terms of mental health stigma amongst young men, I think it is getting better more and more. We're seeing conversations being had and people being open about how they're feeling, which is really good to see. It's come a long way, even in my lifetime, but I still think that there's an awful lot of work that needs to be done to get it to where it needs to be to make sure that people feel comfortable talking about these kind of issues.
It certainly is still there. Like even still, for me as a young man, it is still quite kind of difficult to talk about my feelings or, my mental health or whatever. I mean, all the supports are there. I know all the supports are there, the same supports for men and women, but I find it's more difficult for us to access the same supports and the same level of supports.
I definitely felt the mental health stigma among men has improved this year for me. I definitely still think there is a long way to go before we can say there's true mental health stigma among men has decreased and there is more conversation to talk about it, but I definitely think it has improved and it definitely is looking good. There's more talking about mental health in general.
I do think that mental health stigma in young men has decreased over the past number of years, but I do think there is quite a long way to go.
The main kind of feeling I had going into Jigsaw was I was very nervous because, it's hard to get over that mindset of not talking about your problems, burying them. And I knew when I was going into Jigsaw that the focus would be on me and I'd have to talk because, that's why I was there. But I'm really glad I went because it was both times I went, they were kind of small enough problems that were affecting me at the time, but they would have grown to be a lot larger. And I'm really glad I got to nip them in the bud.
Thank you very much for that presentation, Ian, and thanks for putting that video together of those young men. Very interesting insights there, and I suppose it's a hopeful message in a lot of ways that we're moving in the right direction. I'd love to pick up on loads of those thoughts that were highlighted, but we want to move on quickly to the panel. I just would call back to the sheds and some of those young men in relation to the positive use of the likes of the text service and WhatsApp groups for positive messaging to men, and just follow up on what Ian's call to action there and sharing the 50808 number with the men in your lives today if you can. So I'll hand over to Biddy O'Neill, my colleague in the Department of Health, Healthy Ireland, to chair the panel.
So I'm delighted firstly just to acknowledge and to thank the HSE for giving me the opportunity to chair this panel, and I'm a bit blown away by those presentations because there was so much learning and so much insight in all of them. And I'm sure, and I can see that from the level of questions coming in as well. So it's been a really interesting morning, lots of diversity there. And I think there's lots of opportunity now for some questions and some discussion. So I'd like to call on my colleagues to join us now on the panel. So we have Colin Regan, who's involved with the GAA, Martin Rogan from Mental Health Ireland, Collie Fowler from the Men's Health Forum, Noel Richardson, who's been part of Men's Health since its inception many years ago, and Ian Parr from Spun Out. So I'm delighted to be joined by these men this morning, and I've known all of them for quite a number of years, and their passion and interest in men's health has been evident in their involvement both in research and programs and engagement on everything to do with men's health. So I'm delighted to have them here on board with us today. So we've many questions in from the audience. So I'm going to kick off with a few questions ready here that I've picked. So Colin, I'll give you this first one. So we've learned about the unique challenges facing farmers, men in sheds and young men this morning. Are there other vulnerable groups needing our attention?
I think, Biddy, and thanks for having me. I think it's important to remember that probably everybody has been impacted in some way by the pandemic experience. And you know, when I saw the testimonies there from Brian and from Tony from Men's Sheds and the suite of speakers of young men talking about their experiences, I think while it's really important that we identify vulnerable groups within the broader male population, you know, there are a lot of consistencies across. So like I was thinking, I know young farmers who are in men's sheds that cross all three of those groups, and many of them would also be GA members. We were delivering a psychological first aid webinar on Monday, and one comment really jumped out of it for me, Biddy, was that every interaction can be an intervention. So, you know, as we amass all these here experiences and take all these learnings, as you said, from every aspect and every facet of Irish life and how that manifests for men, we can bring all that learning into our engagement with males, no matter what setting or what cohort we're working with. And the GA is a very broad church. You know, we had challenges trying to engage players as young as 6 and members and officers as old as 86 when the pandemic hit. And you know, as some of the questions were coming in there, we recognized that while there was great opportunities through technology and that cut down on some of the pressures of our volunteers in terms of travel, etc., there was a challenge of still maintaining that real human connection with particularly those older men who have served the GS so well throughout the years. And we know from our work with Tilda that it's the connection, you know, beyond anything else, maybe that can determine how they feel in their own skins and how well and connected they feel into their community, and how that reflects their own identity, be that as a farmer, as a GA supporter, you know, as a men's shed participant, or as a young man in Ireland today. So I think it's really important for us to keep, while it's essential that we identify the bespoke needs of particular groups and cohorts, that there's the big picture that we should always be aware of as well.
Okay, thank you, Colin, for that answer. And I suppose just on from that, the word connectedness really struck me across all the presentations, and I really like the way there that you talk about men and young men as opposed to segregating them into different groups. But so yeah, so that's really nice to think about it that way. So Martin, I might put this next question to you. The theme of isolation and loneliness has cropped up a number of times this morning. Are there practical tips we can offer people to support others, especially in the time of COVID?
I think, Billy, like you say, and what's been really positive and encouraging about this morning, I suppose for a long time we understood that men were reluctant to talk about mental health, and as we've seen from the presentations earlier, that we've stepped forward on this one. And I think sometimes, you know, when things are going well in our lives, we take certain things for granted, and being connected and having relationships and being part of a broader community network is something that people have sometimes taken for granted. And I suppose we understand now that we're not designed to be soloists. You know, we're incomplete as individuals, and we need relationships, and we need a broad variety of relationships and a different type of appetites. And that doesn't mean that we should all suddenly try to become extroverts, because many people are very comfortable with solitude and spending time in their own company. But we've seen over the last number of months that people who either accidentally or by design had actually a whole series of inbuilt coping mechanisms into their lifestyles, and they were involved in sport or music or their local choir or some local group or chatting to people down at the mart. When you remove these little scaffold elements, one element at a time, people hit a point where suddenly they're finding it really difficult to cope. So certainly I think we have to be very mindful of this, and we're very alert to it. And obviously keeping the public health messages about social distancing and 2 meters and masks in mind, but we can still make connection. And it's really important that people proactively do this. It's a little bit like the Bord Gosh ad. Don't wait for someone else to make that call. So I would encourage people to proactively make links, not just for their own health, but also to link up with people who they recognize that they somehow dropped off the grid or we haven't seen recently. And that might be an older neighbor, it might be someone who's recently had a bereavement, it might be someone who's traveled through a family breakup or in difficulty as well. But be the person who makes that call. Don't wait for someone to call you. And indeed, if you're feeling isolated yourself, pick up your phone, go through your lists and say, here's someone I haven't spoken to in a while. And it's very important that people don't burn out their existing relationships, particularly where people are staying within a family unit or a closed group in order to minimize the risk of COVID. But we do need variety, and we have different relationships with different people we talk to about issues relating to finance or our health or sport. So have a broad range of people that you can tap into and also be available. I think people have probably heard Joe Duffy describing a caller saying that he would rather receive 1,000 calls from someone who's in difficulty or at risk than to receive one phone call to say they've lost a member of their community. So I think in Mental Health Ireland, we use 5 ways to well-being. So it's about connect, actively do that. It's also about staying active. So get outdoors, particularly early in the day. If you get a good day like today, brightness, outdoors, and like it's programs like our Woodlands for Health program that encourages people to get out and have some companionship. And it's a partnership with Quilcha and Get Ireland Walking. And we're really keen to encourage people to do that. But basically just meet up or even arrange an informal kickabout, but definitely get out and stay active. And I think one of the speakers there earlier mentioned on one of the video clips, a young man talked about the importance of routine. Don't allow yourself to lie on and get up at 10:30, 11 or midday. Try and stay in your routine as best you can. And even if it just means if you're not going to have an intimate conversation or chat, even to be out in a social space and to see other people. This helps us to regulate our mood, to be active and to be in connection. And if that just means sitting on a park bench, but be seen and see other people, it's really important to maintain our mental health. So there's many other tips, and we'd encourage people to visit Mental Health Ireland, and we've developed a lot of different resources in co-production with people who use mental health services and wider partners for some really good guidance on that. I'd encourage you to check that out.
Great, thank you, Martin. That's a very comprehensive list of tips there for people, so well done on that. I was struck by one of the young guys on the video from Spun Out where he said he had to get over the mindset to ask for help. And I thought that was really nicely put, and he was so glad that when he did. So it was like that challenge to him to ask for help, but he was able to nip issues in the bud. So I think there was big learning in that for all of us. So moving on to get through some more of the questions, and Noel, I might go to you next. And so this question is around the fact that, you know, for men, their self-esteem and identity and self-worth are very often wrapped up in their work and their provider role. And, you know, what impact has the pandemic had on this? And are there opportunities in it?
Yeah, I think it's a really interesting question, Billy. I mean, it's well established that, you know, men whose identity or self-esteem is reliant on one aspect of themselves, you know, be that work, or see it's in relation to professional sports people. If you take that away, you know, if a sports person gets injured or retirement, you know, their world can collapse. So I think the pandemic is an opportunity for men to kind of take a step back, to take stock, and to kind of recalibrate what's important in their lives. We often hear economists saying in the midst of every crisis lies great opportunity. And I think this is an opportunity in a funny kind of way for men to kind of actually take the opposite view and look at ways in which they can strike a better work-life balance for themselves. Take some tips that Brian suggested earlier in terms of finding more time for themselves, and investing more time in their relationships, in their family, in their communities. So I think certainly my hope would be that this will be kind of an opportunity or a time for men to kind of realize that it isn't all about work, that being present and available in terms of family and community are the real kind of gems, if you like, in terms of what sustains us and what nurtures us. So I think hopefully it will be an opportunity for men to take stock and to kind of reevaluate what's important, I think.
Okay, thank you very much, Noel. Thanks for that. Collie, I might move on to you for this one. And it's like, it's the impact that downturns and economic crisis have on suicide rates. Like, you know, and we know from previous research that the last economic downturn had a big impact. And now we have an economic impact again from COVID. So like, what are the intervention measures we can take to reduce the risk for men?
Thanks very much, buddy. I suppose one of the things is that the evidence is quite categoric that the economy and recession can have a huge impact upon men's health generally and mental health particularly. If you go back to 2011 and our last big economic crisis, the Institute of Public Health put out a really good review report, kind of sort of outlining and highlighting how that impacted men specifically. And our own report in 2008 on middle-aged men and suicide showed similar trends. The interesting thing, I suppose, about economic recession is that at one level, men don't have control in that. They don't control the economy. They can't do things. So there's things at a macro level that need to be done. We need certainly at this minute in time to be looking at how do you retain people in work so that they can earn. We look at mortgage relief. We need relief on interest rates being paid at banks. So that's the stuff at the big end. And at the other end, there are the things for men themselves. Now, I suppose in our work in the Men's Health Forum, we work on this idea of a health impact pyramid. And at the top of the pyramid is what individual men can do to change their behaviors, their attitudes, their beliefs. And at the bottom, there's what the society level things need to be in place, the policies, the economic strategies and whatever. But for the men individually, I suppose, and for the groups who work to support men, this is the time at which we really need to get our finger out and we really need to start creating, as we have often said, these safe spaces. And in Ireland, across the whole of Ireland, there's a huge amount of groups doing fantastic work to give men a safe place where they feel respected, that they can come together and talk to other men about what they're going through. Because the worst thing we can do in an economic crisis is to bottle up that anxiety and that stress and that worry about where the next pound's coming from or the next euro's coming from. Because it's not just impacting on the men's mental health, it's also their families and those people who are around them as well. So in this minute in time, I suppose the call is out there for the groups. We heard earlier from the important role of the sheds, and there's loads of other supportive groups around the country who create a space for men to connect with each other, to share about what their experience is at the minute, and to reflect critically on what they can do in the future. Because one of the things that I'm really always amazed by is that men like to be creators rather than consumers. And if you're just a consumer of a service, but you're not creating something new, something that drives you forward, as Noel said, in the world of work, it gives you money, certainly, and that helps in economic circumstances, but it gives you identity, and it gives you pride, and it gives you skills, and it gives you friends, and it gives you connectiveness. And in the hope, I suppose, is that as we move ahead in the next few months, we are sure that the economy is going to get worse probably before it gets better. But I call on all those community groups around the country to do their bit to reconnect with men and connect them to each other.
Thank you, Colin. And I suppose it's really evident again from the messages coming in in the Q&A about all the different groups that are around the country. And so it's really great. This is a really good networking opportunity as well for people to get to know what's happening in different localities and around Ireland. And I've also noticed that some of our colleagues from the north are tipping in as well and joining us and sharing some of their learning. So it's a really good exchange forum. So I think we probably have time for one more question. So Ian, I think I'll go to you on this one. So we're witnessing a culture change around men, and I think that was really evident in some of your young men speaking there, which was really welcoming to hear them saying that we have become more open, and that's really supportive, I suppose, of all the work that's going on. But do you think that in terms of their mental health, has this gone far enough in terms of men asking for help and support, or do you think there's more that we need to do?
Yeah, I think, and thanks to Ross and Kieran and Scott and Adam and Mike for kind of sharing their perspectives. I think it's always really powerful to hear directly from young people and young men in particular what's going on for them. And I think, you know, Kieran was making a really good point that, you know, he knows things are there, but there's a mindset and there's a barrier there, and he even himself is finding it difficult to unpack that. So I think there's work that we can do to try to help young men unpack that. But certainly one of the things that you know, we've kind of heard over the last kind of 8 months is that even though this has been a shared experience, it's been an unequal experience, certainly in terms of the resources you have kind of available to kind of get through this time. But certainly younger men have been reporting kind of more real conversations happening between friends, because everyone's kind of going through something at this moment, and there's kind of less superficial, how are you, and moving on, I'm grand, I'm fine, and more maybe actually taking time to explore and to just listen to what's going on for each other. So I think we have to take advantage of that. And one of the things that I think we can do is to point out to young men the benefit of accessing help and support, right? So a lot of the time we focus on, you know, messages like it's okay not to be okay and all of those things, and they're really helpful in breaking down stigma. But then what's the next step? And I think the next step is about, okay, what's going to be the result of getting help? And so look, sometimes when you access help, it's not going to help. You know, it's going to be that you're not going to connect with the person that you're working with maybe, and you need to find another person to work with. And even making that type of thing known to young men is really important, so that they don't get put off in their help seeking journey as well, and maybe stop. And as you saw there as well from Mike, I think it was really interesting hearing him talking about the fact that reaching out for help, he knew, okay, actually I'm going to have to confront some things head on here. I'm not going to be able to kind of shy away from them, and kind of helping younger men to kind of get ready for that internal conversation even before they're ready to have an external conversation with somebody else. So I think there's, you know, it's positive. I think the trend is moving in the right direction, as we heard from them all. But, you know, all of them did say as well that there's work to be done, and fingers crossed, you know, this is today has been a huge help in kind of helping us all to understand that and what we need to do a little bit better.
So thank you, Ian, and I'd like to thank all the panelists, because I think we're just about to run out of time. We've had a lot of questions in, and there will be an effort made to respond to all those questions and get back to you all. And yes, I suppose there's been a lot in the session this morning, and a lot to ponder. And I think one of the most powerful things always is the message coming from men themselves. So I think one of the most powerful ways to impact on young men is hearing young men talk about what they've done, and the same for Sheds, and the same in all the other areas. So I would like to just take the opportunity to thank you all, the panel, for sharing this morning. And I suppose the one message that stuck with me, which I will just share with you and then hand back to Virgil, was from Brian, the farmer who spoke earlier, when he said, "We only have to get to tomorrow." And I thought, what a lovely mantra to have with your family when you're in times of trouble, and when there is an anxiety among everybody. So that's one of the takeaway messages from me from today, that we only have to get to tomorrow. So thank you, panelists. It was really enjoyable, and I'll hand you back to Virgil.
Thank you very much, Biddy, and thank you very much to the entire panel there. We're drawing on your huge experience and your work in the area of mental well-being and men's health and community engagement and health and well-being generally. Just one more thing I want to give a shout out to before I close up our webinar today. The Men's Health Forum, you heard there from Colin Fowler, the Men's Health Forum and ourselves, we funded the Men's Health Forum to produce a trends report and report card that'll be coming out hopefully on the 10th of December. So it'll be, that's going to give an overview and an update on health statistics for men across the island of Ireland, and the report card is an infographic piece that I'm sure will interest you all, which will highlight statistics in the Republic. So I think we'll have something there that'll be interest to everybody, and we'll be in touch with you about the launch of that. We will do a sum up email that will give a lot of links. I know there were signposts called out by a number of our panelists and speakers today, so we'll try and sum that up and get that out to you. We will be given a recording, putting a recording of this webinar up on our YouTube channel for if you want to share that with everybody. And I suppose that's about it. Just to sum up, I suppose the key messages for me, we're seeing improvement in engagement, mental health, and really, like Biddy said, having men give their own experience today, that was probably the most powerful that we saw. It was very, very powerful. And even hearing men say how they jumped the hurdle of engagement around mental health, like Ian said, like there's nothing more powerful than seeing somebody else, yeah, I struggled, but I did it anyway. So I think that's a great take home. The other things that's been highlighted by a couple of you is the equality issue. We didn't all start at the same place, so we're not all navigating this at the same pace. So I think we just need to consider that when we're talking to our family and communities, or trying to engage. And then just to echo again the key theme of the overall thing, like the Minister said at the outset, as part of the Keep Well, it's about connection, okay? And so many community initiatives and so many national initiatives and so many websites and so many supports, but we need to stay connected and keep encouraging and use those WhatsApp groups and networks that you have in a positive way. So look, thanks again to everybody, and thank you to everybody for tuning in and taking the time. And I hope to talk to you soon in some way by webinar or email. Thank you very much.